I'm just going to take a few minutes to outline what we've been able to accomplish here in Georgia. Using geospatial information systems and geospatial sciences and technology. It's been pretty amazing. And so I'm so honored to be able to share a little bit of this. And I just wanted to let you know that we do work from a state perspective. However, this slide kind of shows the mom and apple pie statements about what the Georgia Geospatial Information Office does in non-COVID days. We're here to empower all levels of government to higher efficiencies and effectiveness through innovation. And that includes state agencies, our authorities, our regions, our regional government, and our local government. So we're really here to help every level of government and thus help deliver the services that we all provide to our citizens. And in terms of geospatial technologies and those sciences, when we're talking about efficiencies, we're really talking about protecting the investment in GIS. GIS is not cheap. And one of the things that I see pervasively across the globe, really it's not just here in Georgia, is that we often invest a tremendous amount of time and money and energy into the development of really valuable data. And then we don't show it the respect that it deserves by maintaining it long term. And so our goal is really to help protect those investments, build things once, use them in many ways, and to facilitate interoperability among all levels of government throughout the state of Georgia. And then as far as effectiveness, we're really about enabling better decision making. And that often comes with innovation and access to data, and most importantly, analytics. I think that a lot of times, one of my colleagues on this panel mentioned that we often find ourselves in situations where people think that GIS is simply a map making tool or maybe a data creation tool, but they kind of leave out that analytics component. And so that's been a real success place for us. So let me just jump into what our life looks like during COVID times. Our goal is still to empower all levels of government, but it's really been focused on access to data, analytics, and innovative approaches to solving problems and challenges, whether those be old problems or new problems that have come up during COVID. I want to be really super clear that we are a team of two, and we were a team of one until 1 week before COVID. So everything that I'm about to present was done through the collaboration of a ton of different people. And our agency is very tiny. We are literally 2 people right now. We're working to expand that, but the Geospatial Information Office in Georgia is brand spanking new. There hasn't been a focus on state level data management or enabling geospatial sciences of that scale. So during COVID times, we found ourselves helping to facilitate and manage a group of anywhere from like 10 to 30 people at a time. And I'll just kind of go into a little bit of detail on how we've organized those groups. But our big focal areas have been on providing kind of a course scale viewpoint that might have not been immediately visible to the people who are working with inside our agencies or our local governments. We're able to kind of step back and help with identifying, the opportunities for cross collaboration. We were able to step back and say, gosh, we see a little bit of duplication of effort, whether that's in data creation or application development. We're able to kind of step back and see that. So we've really come in and tried to come in and given support to our governmental entities in Georgia by focusing on problem solving, by providing ideas and innovative solutions, and at all times, and I really want to stress, showing visually the possibilities. That's been a real key, I think, to our success, is prototyping. And Jake said earlier, you know, being able to start things, build them, walk away from them if you need to, you know, change them based on user needs and feedback from your user community. So we have started and stopped and failed and succeeded, and we've done that repeatedly over and over again. And like Jake, we have applications that I think are the greatest thing since sliced bread, but right now they're sitting on the back burner, and we just weren't able to get that champion or to move it over whatever barrier we were trying to cross. So, but we have an amazing group of people, and I wanted to focus on something that Esri brought up earlier. She brought to my attention this amazing article that she mentioned in the beginning about innovation in a time of crisis from Larry Clark at Harvard Business. And I read this article that she showed off to us, and I was just amazed. I mean, it truly, truly captured everything that's happened to us here in Georgia. We have been able to really ride the massive wave of the changing ecosystem that we've seen due to COVID, and really been able to leverage the unique conditions that it has given our organization to push forward in Georgia. And by push forward, I mean we have just been like a bulldozer running forward whenever we can with our amazing collaborative group. And I think that, you know, the key points that that article brings up are, you know, leveraging the massive spike of energy that's present in your workforce during a crisis. That has been hands down the most amazing part of what we've done. It's the humans. It has nothing really to do with the technology. The technology is awesome, and you know, it's great. I don't want to downplay it. If it wasn't there, we wouldn't be able to do what we're doing. But it's the humans really that bring it all to bear, and they're the most important thing to focus on. And so we've really focused on pulling them together and giving them an environment where they can be creative and let their creative juices flow. You know, that we've been able to bring in consultants. We've brought in Esri and also the Georgia Tech Research Institute. They've been able to give us really good outside perspectives and come in and ask the critical questions of like, why are you doing something this way, or why aren't you doing it another way? That's also been incredibly helpful. We have really leveraged the alteration in the bureaucratic overhead that, that Larry Clark references in his article as well. And then we've also been able to create an environment that encourages that experimentation that I've mentioned, that Jake was mentioning. You know, I think we've all kind of brought that up as a topic. We got started by helping to support our Department of Defense, who was supporting the Department of Community Health, who needed to answer the question of when, where, and by how much is our state going to be in danger of being over capacity in our hospitals, both for different kinds of beds as well as ventilators. And so we were able to amass a really amazing think tank of people to do some predictive modeling. We leveraged the University of Pennsylvania CHIME model, the University of Washington IHME model. We had several modeling teams from Georgia Tech who came in and partnered with us, as well as from MIT. And so we were able to, I don't know how it happened. It was instantaneous and amazing, but we were able to pull together this great group of people to start modeling this and saying, you know, what is it going to look like? When are we going to be over capacity, and by how much? So we started with that. We quickly moved into the creation of a COVID data hub, which is really a clearinghouse for all the great work of others. I jokingly say I do a lot of R&D, which is rip off and duplicate, but it's absolutely true. You know, it's really other people's work that we're highlighting. And by the way, thanks, Missouri. We definitely take advantage of that infographic. We love it. The impact report is amazing. But we also were leveraging a lot of other third-party resources on our site in the areas of COVID data, planning data, social distancing and mobility. This was a really hot topic for us, you know, understanding when we were under shelter in place, are we really doing shelter in place? So we leverage the knowledge that's being put out there in the universe about credit card transactions and cell phone movement, things like that. Business and unemployment, that's been a really hot topic. Social media, we're doing a lot of scraping of social media feeds and news feeds. And then, of course, vulnerable populations, which is a very hot topic for all of us. This effort has only been successful because it's been about collaboration, and these are the groups that have been involved. They've all been just amazing, and I want to stress relationships. This is an obnoxious chart, and you don't really need to acknowledge who it is, but I just want to let you know that the GIO, before we, the two of us, got started in this endeavor, the people in this circle were the only people that we knew. And through COVID, we've been able to create connections with all these other groups that have really led to our success. We've broken our group up into a think tank that I told you about, and we've focused on 3 major areas. We have 3 working groups: data and analytics team, a modeling team, and then a visualization and application development team. And we have really focused on data science. And again, I mentioned that a lot of this work has been done by Georgia Tech Research Institute and by Esri. They've just been amazing at what they've done. And then I want to also say that application development has been a major focus for us. And I cannot stress to you enough that we would not be where we are today if it wasn't for Esri's disaster response program, the DRP. If any of you do not know about, you must know about it and you must leverage it. It allows you to get basically endless amounts of Esri resources for free. And if we had not been able to do this, we would not have been able to meet people where they needed to be met during a crisis. We would not have been able to prototype things. We would have been restricted by our licensing and, restricted by our ability to get a hold of critical data or application tools, or development tools, I mean. So the DRP is really, really pivotal. It allows you to show people what is possible. And I have personally found that if I don't show somebody, physically show them something, especially that shows their state or their community, they can't grab it. They can't grab it in their mind. And so tapping into the DRP was literally one of the most important things that we did. Also working with our marketing team from Esri, because they came in and for an entire month, they helped us do stuff before we were able to then engage in an official contract with Esri. But for a long time, we were not, and they were just amazing, unbelievable. We would not be where we were without them. This is our solution stack in case anybody's interested in the infrastructure and the tech. We're really tapping into lots of things. And again, 0 of this existed before COVID. 0 of this existed before late March or early April. None of this. And we've really tried to step back and follow best practices, looking at things like cybersecurity and creating really proper development and production environments. And cartography has been a real big issue for us that we have focused on. Georgia's gotten some very negative press about cartographic choices, and they're challenging. They're really, really challenging, but we're trying to improve on that. And so again, we've just focused on data and analytics, figuring out who has data, how do we need to move it around, who needs access to it, are we collecting dailies and cumulative counts, where are our problems. I mentioned our data hub and our hospitals work. We've also worked with long-term care facilities, understanding patient and staff outbreaks. We've created dashboards for situational awareness. And we tried to work with our testing facilities. This is one of our kind of didn't quite work out so well areas, but we tried to show them what's possible by showing what it would look like to cover the state with test sites strategically rather than reactively. And then we also started working with our schools to say, okay, well, it's not enough to know just about COVID data, but you really need to understand so much more about what's happening in your community in order to determine how to open schools, and then what are your adjustment course strategies throughout the year. So these are the things that we've done in Georgia. I want to just make a plug. If you guys don't know your state Geospatial Information Office or the equivalent thereof, please, please, please consider figuring out who that is and tapping into them. They're probably an amazing resource for you. And you can find them at the National States Geographic Information Council. We were brand new to our Department of Health and our Department of Community Health. They didn't know us from a hole in the ground, and so we had never interacted with them in any way. Each of them has a tiny bit of GIS capacity internally, so it wasn't entirely new, but I think that they had really GIS as a tool for data creation, like Adam was saying earlier, and that we had to overcome that paradigm to explain that it's a holistic tool. It's not something you stick on the side of something and, you know, put some dots on a map. That it really can do a whole lot. And so I think our most successful strategy was that we listened very closely whenever we were able to get ourselves invited to meetings. We listened very, very closely, and we identified little tiny baby projects, and almost all of them revolved around data automation. You know, taking something that was in a spreadsheet and being hand jammed in and automating that. Saying, well, that data comes from somewhere, let's automate, let's write a little Python script, automate the movement of that data from wherever you're scraping it into your Excel spreadsheet. And the littlest tiny thing like that would open up the door, and they would, you know, every time we were kind of thrust into a different agency, the first reaction was always, who are you? Why are you taking up space in my life? I have a lot to do. And we would then provide one little tiny thing that helped them. And then they'd be like, oh, well, you're kind of useful. And then we would say, okay, and I said it when I talked earlier, in every case, we tried to walk in the door with a mock-up. Whether that was just showing off another state or another city or another county's approach to something, somebody else's dashboard, somebody else's tool, and then helping them extrapolate and envision that with their own community or their own geography, whatever that was, we would have failed miserably. And that's another reason that the Esri emergency program, again, for anybody on this in this summit who doesn't know about that, you really need to. You can ask Esri for whatever you want, basically. I mean, that might be an exaggeration, but you will get it. And it's time limited and blah, 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 blah. But you deal with that later. If you become mission critical, then the money starts to flow, right? And so to be able to have at your hands, I had an ARC Pro license. That was all I had before any of this started. And I let my intern have that. So I didn't even have anything. And now we've got a ton of stuff in play now, but it was, we wouldn't have been able to prototype things. We wouldn't have been able to mock stuff up. The data coming out of public health is just amazing. Our hospitals, I will just mention really fast that it's really been great to watch our hospitals and our public health groups see the data visually and understand the impact of their data entry. So we've been able to identify anomalies that people were like, oh, oops, weren't entering that, you know, we were interpreting it differently, or we had a lot of situations where people weren't entering data in our hospitals on the weekends for some reason. And it made the numbers go whoosh, you know, way down.